the key is, as we go through this wave, a key imperative is to get our healthcare protocols readjusted, in fact, reconfigured. And you need to shift decisively to cope with a much larger number of infections. Based on the characteristics of Delta variant, which DMS has presented, we will make the following 4 major changes. First is quarantine. At these numbers, our contact tracers can no longer interview every infected individual, map out their whereabouts and contacts, and try to link them and try to form clusters. Each interview takes about 2 hours. When we are 100 cases, they can interview everyone. At these numbers, it's not possible. So instead, we will focus our resources to deal with vulnerable settings and large clusters, such as hospitals, schools, nursing homes, should they be infected. We will also rely on simpler, scalable methods, such as automatically quarantining household members of the infected, and then make them serve home quarantine. We will also generate a list of close contacts using trace together data. So for very close contacts, we will send out health risk warnings so that they will get themselves, they are required by law to get themselves tested and self-isolated until they receive a negative result. For contacts that are not as close, we may send health risk alerts for them to just monitor their own health closely. That's the first change. Second change, as the incubation period for Delta is shorter, as explained by DMS, with a median of under 4 days, we will shorten the quarantine period from 14 days now to 10 days. This will be less disruptive to people and yet capture a significant majority of infected cases. Third, based on the finding that infected individuals with CT above 25 are no longer infectious during the recovery phase, we can also bring forward discharge. Today, an individual is discharged on day 10 if he's tested negative or CT above 30. We will now allow discharge for day 7 if he is tested negative or CT above 25. If not, he will be discharged at day 10. We will continue to review the data and tweak the discharge policy accordingly. Fourth, we will move decisively on home recovery. This is very important so that hospital beds are allocated to those who truly need medical attention. And it's important, very important to do this when case numbers rise. Today, the large majority of infected patients are in hospital more for observation, and most are discharged uneventfully. So we started a home recovery pilot project for 21 individuals, with 9 already discharged. It has worked well. The individuals are relieved. They can recover from home, and their neighbors has been very supportive, very understanding. I really thank them for that. We would have wished for more time to expand the pilot before making a bigger move, but we have no time to do that. We will implement in the next few days a default home recovery for 2 groups, or rather for 1 group of individuals, and strongly encourage home recovery for another group of individuals. So for the first group, default, and these will apply to those who are young, fully vaccinated, who do not have underlying illnesses or comorbidities. They must not live with any vulnerable persons, such as pregnant, immunocompromised, or anyone above 80 years old. Their homes must have a room with an ensuite toilet. We will start with younger persons and then gradually raise it to individuals who are about 50 years old. And this will account for about 50% of infected cases now. Second, strongly encourage are for infected children between 5 to 11 years old. Many parents have in fact been requesting for them to recover and to be cared for at home, especially when the children they can see are generally well with no or very minimal symptoms. But our hospitals have been cautious and have been admitting these children to the ward. So we will change this policy and encourage parents to bring children infected with COVID-19 home for recovery. At the same time, we will ramp up our community care facilities, isolation beds, and ICU beds. With all these changes, we can handle about 1,000 infections a day. And we have drawer plans to make further changes to the protocols and ramp up more facilities to handle beyond 1,000 cases a day, which we are likely to, I think. I should point out that the protocols I just described are similar to those practiced in US, UK, Europe, and also Japan. Their starting point is influenza protocols. Our starting point is SARS protocols. But in terms of severity and transmissibility, COVID-19 is somewhere between SARS and influenza. And so we find our practices converging over time as we learn about dealing with COVID-19. Now, boosters and vaccinations. While we have a very high vaccination coverage, we will continue to administer vaccines. Our mobile and home vaccination teams, including many volunteer nurses and doctors, continue to work hard to get our vulnerable seniors vaccinated. We have announced the start of a booster program. Our specialist outpatient centers will offer booster vaccinations to fully vaccinated immunocompromised persons from 15 September 2021. In addition, there are about 900,000 seniors aged 60 and above eligible for booster shots. From 14 September 2021, we will be sending out some 200,000 SMSs to those who took their second shots in March this year or earlier to make an appointment for their booster shots. And the booster shots can either be Pfizer or Moderna vaccines, as recommended by the EC19V. MOH recommends that you take the shots, so please come forward when you receive the SMSs. We will also begin administering the third shots to seniors aged 60 and above in nursing homes around the same time. Sinovac. About 1.5% of our population has taken the Sinovac vaccine, administered through the SAR route by private clinics. MOH has also administered the Sinovac vaccine to those who are allergic to the mRNA vaccine. The private clinics had suspended vaccination as their stock has been depleted. MOH has facilitated the ordering of new stock. Barring unforeseen circumstances, they should arrive around 20th of September and be available at some of these clinics a few days after that. In conclusion, I mentioned earlier that to live with COVID-19, no country is spared from going through a wave of transmission like what we are experiencing now. But we have done whatever we can to prepare for this. Circuit breaker, heightened alert, implement trace together, safe management measures, and very importantly, vaccinating the large majority of our population. I consulted widely with my colleagues before preparing these talking points. And after hearing from them, and they asked, since I have the microphone here, they asked whether I can help them convey the following advice to the following groups. Seniors, if you are a senior, during this period, minimize your social interactions for the next 1 month. Just go out for essentials, like buy food or see the doctor. This is especially if you are still unvaccinated. And if you pull down your mask to below your nose and chat with your friends for an hour, you put yourself at a very high risk of infection, and consider getting yourself vaccinated. If you are a young person and you live with seniors who may be your parents or grandparents, please help to protect them. Also minimize your social interactions, cut back on eating out or bringing many friends to your home, because these activities can easily bring the virus to the seniors living at home. If you are pregnant, please understand that the scientific data internationally is very clear that vaccines are safe for you and your baby, but a COVID-19 infection is not safe for you and your baby. So please get yourself vaccinated. And if you are someone who are somehow still not vaccinated or have been persuading your parents, grandparents, or pregnant wife not to get vaccinated, it is perhaps time to reconsider. The risk between vaccinating and not vaccinating has significantly shifted. More than ever, we need to work together, exercise civic consciousness and personal responsibility, and do our part. Take care of ourselves and take care of everyone around us.